Okay, this is the Teflon tape. We're just going to push this in place. I'm actually going to just, because these are shallow spots, I'm going to cut this right here with a pair of scissors, and I'm going to use the tip of this to adapt it in there. And the reason why I'm using the tip of a perio probe is because I want it to condense in the hex itself, right inside the hex. Okay, so we'll compress that, and that's the term I use, just compression. There it goes. And the more compression you get, the better it holds, it seals. So now we'll take a regular amalgam condenser and just like compressing a filling, you compress it in there, so you want to seal it. Now it's easy to go back in on these. You want a certain bulk to your composite, but that is a screw head that's well preserved and protected. Alright, next step, more Teflon. Again, condense the first part of that. Okay. And just push it in all the way. And then take, because you can actually trap air in there if you don't condense the first part of that with the perio probe. Now, there are plenty of undercuts in the framework, so we're not worried about that at all. That actually will be good because it locks the filling in place. Less chance of that coming out. Alright, so here we go. Composite next, and condense it. Some of these new devices now have warmers for composite. Whatever, as long as you condense it thoroughly in there. And then just take a plastic instrument, smooth the top off, and cure it. Okay. So basically we're bonding to metal, and there's really no chemical bond there at all, so it's just locked in through the undercuts, the filling portion that is. Well, we won't say good as new because, you know, the implants in the bridge weren't replaced, but all the parts, you know, everything that holds the system together is all compatible and all going to function well. The threads are perfect alignment. And we'll do a little light curing. I'm using the LED light, strong enough to cure 4 millimeters in depth. As far as adjusting the bite, I like to have the patient squeeze down after it's been adjusted, and then adjust it a little bit more, especially if there are natural teeth involved. So I'd like to go to lighter occlusion on that. So we'll go ahead and adjust the bite and call it a day. Thanks for watching.